welcome to this week's edition of Enthralling Conversations. Today I'm excited to interview Dr. Steven Schachter, a neurologist. So Dr. Schachter, thanks so much for joining us today. I'll start with the basics. Who are you, where are you, and what do you do in the professional epilepsy space?
Hey, thanks, Laura, and thanks for inviting me to be on today. I live outside of Boston. For many years, I was an epilepsy doctor at Beth Israel Deaconess Medical Center. Now I work with a group called SIMIT, CIMIT, which is involved in developing new medical technologies to help people, including technologies for epilepsy.
And how did you get into the field of epilepsy to begin with? What kind of drew you to the field?
I developed a very strong interest in how brain and behavior were intertwined. And during my neurology residency, it seemed to me that that people with epilepsy were living with a condition that where their mind could be affected by their brain and by their seizures, and it just seemed like a way to pursue my own personal interest. But as I got to know more and more people with epilepsy, I soon realized that my passion for epilepsy was to help people live with it and live the best life they possibly could.
Yeah. And, Stu, just to get to know a little bit about you personally, you said you live outside of Boston, and how many kids and grandkids do you have?
2 and 1. So I have two sons, both married. One couple is the proud parents of a 6-month-old baby in
that's exciting.
Brooklyn, New York. So that's a lot of fun. My older son actually worked for the Epilepsy Foundation affiliate in Boston a number of years ago, helped develop their website.
Wow.
And my younger son, David, was involved with a movie that Epilepsy Foundation funded a few years ago. So we've taken a whole family approach towards helping the epilepsy community.
No, well, that's great. You have a 6-month-old grandbaby, girl or boy?
Boy, Avery Isaac.
Oh, nice.
And he seems to think everything in the world is meant to be food. So,
I have a little granddaughter. She's 7 months old, so just a little older than Isaac, and she's actually staying with us right now.
Oh, nice.
And she doesn't eat food very well, so I'm not sure if maybe Isaac could teach her, but she's not doing great on the food thing yet. But, last personal question that I really want to hear more about your journey with epilepsy. If you ever retire, although I wonder if that's ever going to happen, what's on your bucket list? Is there something you really want to do?
Might sound trite, but what's on my bucket list is what I'm doing now. I wish I had a little more time to explore some hobbies, but first and foremost, I feel like I'm still pursuing my calling, my mission, in life, which really is to help save as many lives as possible for people living with epilepsy, and at the same time to improve the quality of their day-to-day lives to the same level as people not living with epilepsy. So, I derive huge satisfaction, fulfillment from that. So it's going to stay on my bucket list.
All right, well, that's good to know that your life's work is your bucket list. We should all be so lucky. So, Dr. Schachter, I know you've obviously been in the field for a long time. You were also on the epilepsy board for how many years? You just came off. How many years were you on the board?
I don't know the exact number, but I know between the Epilepsy Foundation and the Epilepsy Therapy Project, and I was off the Epilepsy Foundation board while I was on the Epilepsy Therapy Project because I timed out,
Right.
But between the two of them, it's really about half my life.
Wow.
And that's a long time now, about maybe 30 years, something like that.
Well, that's impressive. So you've seen so much in the space. What is the difference between when you started in the epilepsy field and what you see today? How have things progressed? What have been some of the greatest achievements that you've seen in your career?
Well, I think, you talk about having a grandchild, if you see a grandchild every day, which we're lucky to do by Zoom, you don't see them grow quite as fast as if you see them only once a year. And likewise, I think there have been tremendous achievements in the field of epilepsy, but from day to day, it seems like we're not moving fast enough. But when you look at it with the lens of 30 years or so, 40 years, because before I was involved nationally, I was involved, of course, in my practice, but also with the affiliate in Boston, which is now the New England affiliate. There have been tremendous advances, and I think what I point to from a doctor's point of view, we have so many more treatment options now, both medications and within medications, oral medications that we always have, but also now sublingual and nasal and rectal and different ways to administer medications. And we have a number of non-medical therapies as well, whether they're implanted seizure detection treatment devices or other forms of non-medical behavioral therapies. We also now have therapies that are specific, that are meant only for specific types of epilepsy, such as some of the genetically determined epilepsies like tuberous sclerosis. And we have a fundamental change, I think, in the focus of care for people with epilepsy. When I started, it was primarily just get the big ones under control, meaning the tonic-clonic seizures under control, and that was about it. But then it evolved to control all types of seizures. And then it turned into helping people with epilepsy live to their fullest potential, which of course involves seizure control, but also identifying and treating other problems that they may have, whether they're in their social life or psychologically. And most recently, I think, a focus on preventing premature death, whether we refer to SUDEP or something I'm pursuing now, which is sudden cardiac death. So tremendous advances. And also, again, from the doctor's point of view, I think with the COVID epidemic, we've seen how effective telemedicine can be, particularly where you don't have to examine, the doctor doesn't have to physically examine an individual. So I see the technology around telemedicine being of particular good use for people living with epilepsy. And also I've learned it's a way for support groups now to organize themselves, so you're no longer bound by geographic, constraints.
Right. And from the perspective of people with epilepsy who have trouble with transportation, they can't drive, it makes so much more sense to be able to support through telemedicine or support groups using digital technology. So I think there's a huge expansion in the field because of digital technology. And I think Zoom really taught us how much more we could do, right?
Yeah, absolutely. But, I think there've been some negative trends as well that we need to keep an eye on. And
yeah, like what?
The pressures on doctors, in terms of time spent with patients, insurance pressures and so forth. So I see telemedicine and other enabling technologies as helping move the care model for people with epilepsy, particularly those who need more help, move the care model from an episodic, like, go see the doctor for a certain symptom model, to a chronic care model, or, where through telemedicine, you can see the nurse specialist or the psychologist or the neuropsychologist, or have team meetings, or, just, and not be so constrained by office hours or, days of the week. So for years, we've recognized that the care of people with epilepsy doesn't fit the current acute episodic, medical model. It's just it's a square, peg in a round hole. So with the COVID epidemic, hopefully now we can see a way towards telemedicine being, the key enabling technology to make that happen. Of course, I know the foundation's interested in that, and CDC and so forth. So that's going to be quite helpful.
So, Dr. Schachter, in the minute or so we have left, I know that you've kind of gone from being, in the academic medical center world to now working at SIMIT at MIT, which is obviously a more entrepreneurial piece. What is the most exciting thing that you're working on or that you're seeing evolving out of the SIMIT work?
Within the field of epilepsy?
Yeah.
Well, I personally have some projects that I'm very excited about. One is a botanical, a drug, a compound medicine that's found in plants that appears in animal studies to be a potential new treatment for epilepsy. And I started that work about 10, 11 years ago. Received funding from the Epilepsy Foundation to help start the clinical program on that. Another project, which is more technological, I'm excited about, is a finger stick test that could be done in the doctor's office or eventually at home, where within a matter of minutes, you'll know what the individual's AED level is in their blood. And I think that'll help revolutionize or certainly streamline and expedite decision-making and also communication on what to do about doses so that people can optimize currently available therapies. I mean, we have, 20 plus therapies for epilepsy. I think it's more common than not that treatments are not fully optimized before switching to another new drug. So right now it's so difficult to get levels. You talk about trouble with transportation and so forth. That's an issue. And by the time you get the level, it's not when you've had a seizure. It's not when you've had double vision or whatever the side effect might be. So it doesn't help the doctor that much. But this technology, which we're working on now, it has the potential to help with that. And thirdly, as I mentioned a few minutes ago, I'm particularly interested in a potentially fatal complication of epilepsy. We know about SUDEP, but I don't think what the field knows enough about yet is sudden cardiac death, which I believe can be a cause of death in people with epilepsy. And we're working on ways, non-invasive ways, to diagnose a person's risk profile for that, which I'm quite excited about as well, because I believe we can prevent this type of death with enough screening and perhaps some treatments.
Dr. Schachter, you mentioned the sudden cardiac death. Would that be categorized as a potential cause of SUDEP? Is it just one piece that you're looking at?
We run into problems with names and nomenclature.
Yeah.
When it happens, it's certainly sudden and it's unexpected. But the professional field of SUDEP is focused on death that occurs after a seizure from respiratory failure. And that's what most people in the medical community think of as SUDEP. What a group of people and I are working on is a cause of death where the heart suddenly goes into a rhythm that causes cardiac arrest. And it may or may not have to do with the seizure. It does have to do with having a history of epilepsy, but when it occurs, it may not occur either before, during, or after a seizure. So we've developed some non-invasive ways to measure risk for that, borrowing from cardiology discoveries. And we're actively pursuing this from as quickly as we can, because as I say, the exciting thing for me is that I believe that the risk for this can be understood and screened for, and there could be treatments to prevent the heart from suddenly going into a fatal rhythm. So we will have more on this later, but we've published some papers. We call it the epileptic heart, just so people can refer to it as a concept, and hope to encourage other colleagues of ours to join with us in researching this. And it's further complicated, we think, by some of the side effects of some of the medications, which can, we believe, over the years promote coronary artery disease, which of course everyone knows is a risk factor for heart disease. So, and there are some genetic forms of epilepsy too that put the heart at some risk as well. So it's a emerging area, which I think accounts for some people who die from who have epilepsy. certainly it's not the only, the only cause of death, but so we're calling it sudden cardiac death now to distinguish it from SUDEP. And we hope to, push this forward to the point where people can see their doctor, perhaps see a cardiologist, get screened for these risk factors, and take proactive steps to eliminate, if not reduce, significantly reduce the risk.
Well, Dr. Schachter, I mean, that's exciting. The finger stick piece is very exciting. The sudden cardiac death is very exciting. So thank you for sharing this information with us today. It's been great to talk to you. And I will probably be following back up with you again for another interview to get an update on what you're working on, because that sounds really exciting. For people who are watching today, you can click through the links on the bottom of your screen to learn more. Thanks so much.
Thank you.